In 30 years of offering Medicare plans, Humana has served millions as a partner in health. Our goal is to help you achieve lifelong well-being. Choosing the right Medicare plan can help you get the care you need to feel your best. That's easier to do when you understand your plan choices. Humana can help. There are certain times when you can enroll, disenroll, or change your Medicare plan. The annual election period is October 15th through December 7th. During the rest of the year, if certain special conditions apply, you may qualify for a special election period. Ask your licensed sales agent if you qualify. Let's think about your Medicare options. Option 1 is Original Medicare, also known as Parts A and B, through CMS, the Centers for Medicare and Medicaid Services. Parts A and B help cover many hospital and doctor costs, but not prescription drugs. So you may need a separate Medicare Part D prescription drug plan, or PDP. Option 2 is Original Medicare, plus a Medicare supplement policy, along with a prescription drug plan. A Medicare supplement plan, or Medigap policy, helps lower costs by picking up Medicare deductibles and coinsurance, but they do not cover prescription drugs. You will need a separate prescription drug plan for drug coverage. Option 3 is a Medicare Advantage plan, also called Medicare Part C. Many Medicare Advantage plans offer both medical and drug coverage, eliminating the need for a Medicare supplement plan and a separate prescription drug plan. You can get Medicare Advantage plans through private companies like Humana. Medicare Advantage plans, or MA or MAPD plans, offer all the benefits of Original Medicare and may have lower out-of-pocket costs. An MAPD plan is a Medicare Advantage plan with Part D prescription drug coverage. Most Medicare Advantage plans also offer extra benefits. As a Medicare Advantage member, you still have Medicare. You're just using the Medicare Advantage version, managed by the Medicare Advantage organization, like Humana, rather than the federal government. Option 1 is Original Medicare, or Parts A and B. Option 2 is Original Medicare, plus a Medicare supplement policy, along with a prescription drug plan. Option 3 is a Medicare Advantage plan, also called Medicare Part C. Now that you know your choices, how do you choose your Medicare plan? Ask yourself a few questions. What type of plan do you have now? What do you like about your coverage? What would make it even better? Is someone helping you make healthcare decisions? With these answers, you're ready to think about plans. Let's look at a health maintenance organization, or HMO plan. Usually with an HMO, you choose your primary care physician and other healthcare providers from a set network of doctors, specialists, hospitals, and other medical providers. Humana has a large provider network, but if your current doctor is not in our network, the other benefits of the plan may be worth changing your doctor. Choose a new one from our provider directory, monthly if needed, until you find one who's right for you. The providers in our network agree to accept a discounted rate from Humana. With a few exceptions, we pass the savings on to you. You may see a non-network provider or receive non-network services if the plan and your primary care physician approve the visit first. If you need urgent or emergency care while you're away and a network provider is not available, go to the closest emergency room. Most HMO plans require a referral from your doctor for specialist visits. Ask your licensed sales agent whether the HMO plan in your area requires doctor referrals. Your out-of-pocket costs may be much lower. CMS reviews and approves Humana's HMO plan yearly. Let's turn to prescription drug coverage. If an HMO plan doesn't cover prescription drugs, CMS does not allow you to combine a prescription drug plan with it. Ask your sales agent to review a plan's drug coverage with you, including the formulary or drug list. Humana's list of medicines covered by the plan is also found at humana.com. Even if your medicines are listed, Humana may require you to try certain drugs first to treat your health problem before we'll cover more expensive drugs. This is called step therapy. Manufacturers must agree with CMS's terms and conditions to contract with Medicare, so not all brand-name drugs may be covered. In the coverage gap or donut hole, you pay part of your drug costs before additional Medicare coverage kicks in. In 2018, you'll pay no more than 44% of the cost of many generics and no more than 35% of the cost of many brand name drugs during the coverage gap. If you have both Medicare and Medicaid, you may be eligible for a dual eligible special needs plan. Ask your state Medicaid agency and your doctor if this is a good choice for you. Now that we've talked about when to sign up, your Medicare options, HMO plan specifics, and prescription drug coverage, what's next? Your sales agent will review the summary of benefits, which covers many features of Humana's HMO plan and the plan's drug list. If you choose an HMO, decide if you want your certain plan documents by mail or online. Going digital is a great and green way to stay organized. It's also easy. We'll email you a link to humana.com, where you can sign up for My Humana, your secure online account. Go to My Humana to get started, learn about your plan, and see your documents. Your Humana member ID card will arrive by mail. You'll complete a health assessment by phone or online if you've chosen our online option to see if you qualify for any special health programs. Be sure to attend a member orientation. We've covered a lot of information today, but if you have questions, call us. We're your partner in health and always happy to speak with you. Your licensed Humana sales agent who presented your specific plan benefits today can answer any of your questions. Another great resource is the Medicare and You Handbook you should have received in the mail. You can also go to Medicare.gov. Thank you for your time and interest today.